Thank you, Mr. Speaker. I want to speak about a constituent that I've come to know through my constituency office and the events that I've held in my community. She's a devoted wife, a loving mother, and she has stage 4 cancer, which has spread to her bones and liver. Many Albertans fight with all their will to combat this terrible disease, Mr. Speaker. Her treatment regimen consists of drugs which are not available in Canada yet, like Projecta. If she wishes to receive these drugs, she must travel out of country, which is a physical and emotional strain on her and her loved ones. To the Minister of Health, she's not covered through the healthcare system, particularly for the drug Projecta, again adding further costs to her and her family. Mr. Minister, how often do we review treatment plans and best practices to our approach to cancer so that we can provide more in-province?
Thank you. Let's hear from the Minister now.
Yeah, Mr. Speaker, first of all, our hearts and prayers go out to the family. And I can't speak to individual cases, but we have a strong evidence-based decision-making process of determining which drugs can be used and which can't. Drugs new to markets are covered by Health Canada and approved by Health Canada. Our benefit list is updated monthly when required. Cancer drugs included on the list are provided at no cost to Albertans. And Albertans can be assured that we are employing the best practices when it comes to cancer care. I also want to inform this honourable member that the new uses for Projecta are under review at the national level by Pan-Canadian Oncology.
Thank you. Let's hear the first supplemental.
To the same Minister, as you mentioned, the situation is heartbreaking and our hearts do go out to that family. We also know there are similar stories throughout the province, like my own, the loss of my mother, my mother-in-law, my grandmother, and the cancer that's in my father now. Can you tell me, Mr. Minister, that we have a robust and comprehensive plan to beat this disease once and for all?
Honourable Minister.
Yes, I thank to the honourable member for the question. I don't think there's many families in this province have not been touched by cancer. But we have Changing Our Future Alberta's Cancer Plan to 2030, which is the government's plan to reduce the risk of cancer, increase cancer cure rate, and reduce distress for cancer patients. We accomplish these goals by working with partners on various initiatives, including research, screening programs, and providing emotional support to cancer patients. Alberta Health Service latest report on cancer rates show that our screening and prevention efforts are having a positive impact. Thank you, Mr. Speaker.
Final supplemental.
Thank you, Mr. Speaker. Mr. Minister, can you just tell Albertans how they can navigate through the Alberta government this terrible disease, whether it's through websites or information?
Honourable Minister.
Mr. Speaker, we have an excellent service provided by patient navigators that help Albertans with cancer find the resources they need. Patient navigators are at the cancer centres across the province to help cancer patients make informed decisions, understand and prepare them for the treatments. Patient navigators also improve coordination of care by working with other healthcare providers and help patients access financial resources and community supports. We do all we can, Mr. Speaker.